The Minister of Health, Dr. Osagie Ehanire, says the federal government is exploring all options to ensure the vaccination of 70% of the population in 2 years. The minister also gave details on the handbook on home-based COVID-19 care and its importance.
With an eye on value for money, we are negotiating with various parties and planning for flawless execution using all our recent experience from the polio eradication, all in the face of a global competition and, as some say, scramble for vaccines. Apart from the 100,000 allocated as the first wave to Nigeria by the COVAX facility, we also placed order for 10 million, and we're ready to increase that doses from the Africa Vaccine Acquisition Task Team of the African Union Commission, which has secured rights to 270 million doses of vaccine, supported with a 2 billion loan facility by the Africa Exim Bank, using what we call a whole of Africa approach as set up by the chairman of the African Union, who is the president of South Africa, President Ramaphosa. The vaccine is expected to be rolled out as from March or April, and the quantity we order from AVAT will depend on our own capacity here in Nigeria to dispense so that we don't waste any vaccines, as we have seen it happen in some other countries who ordered that discovered that they could really quite cope with the rate of dispensing. So that vaccine management should not become a problem. Nigeria has developed an indigenous vaccine candidate. Another one is under development, but they will require considerable financial investment to get them through the trials before they can be used. We shall be seeking sponsorship, perhaps from the private sector or any other sector, to support the initiative to take this idea further. The development of a handbook on home-based COVID-19 care is to guide the patient themselves, who will, according to our plan, be each assigned to a specific case manager in their home, who himself will be linked to a health facility and will provide not only health advice, but also social support. And in case he has any complications, will be the one to organize his referral to a hospital. And if possible, we also provide psychosocial support and mental support to ensure positive outcomes. All of this will reduce the pressure on the health facility and free more bed space for serious and critical patients. This handbook will also provide Nigerians with guidelines to correct divergent and misleading treatment regimens which are being touted in various quarters about what works and what does not work. The federal government's National Oxygen Intervention Project will see the construction of at least one oxygen plant in every state. 5 facilities in the FCT will get upgraded oxygen plants as well in a separate intervention. In the meantime, the Federal Ministry of Health is arranging for federal tertiary hospitals and isolation centers to interface with each other and explore the demand imbalances among themselves and set up oxygen redistribution systems from those who have to assist those who at the moment don't have, so that there is no absolute deficit or shortage in one,